want to give you a couple different reasons why I feel that family therapy is just as important as individual therapy. A lot of people are taking care of their mental health, they are entering therapy for themselves, and they are learning coping skills, they're learning how to set boundaries, they are learning to explore and process past traumas, past hurts, disappointments, how to goal set for their future, learning a lot of adaptive coping skills. A lot of times what happens is that you make all these changes within yourself and you learn all these great things, and then you find yourself, whether it's in a relationship or you find yourself in a family where you see like, okay, this is like dysfunction here, or I want to learn how to better communicate with my family members. This is where family therapy really comes into place. Family therapy can look like maybe couples therapy, it can look like parent-child therapy, it can look like siblings therapy, it can look like the whole entire family unit. Sometimes you identify the members who are mostly impacted. I want to encourage people to think about that aspect as you are healing yourself first and making sure that you are in a space and where you feel comfortable enough that your therapist can include other individuals in your therapy that might help you move along. Now, of course, as a therapist, my clients are always my top priority. The sacredness of the therapy space is also a top priority to me. So that's also informing people, as we started to explore and process whether or not they want to include that particular family member in their sessions, and getting their feedback and ensuring them that it's a safe space. You are my client, and also reaching out to that other person once you get consent and talking to them about what family therapy looks like. Perhaps they've never been in therapy, perhaps they've never done family therapy. So I do think there's a lot of care and details that has to go on. You just can't bring people in and just expect them to just talk and hash it out, which a lot of the times, if they are prepped well enough and if they understand what the sacredness of this space is, you are able to accomplish that. It's building a lot of rapport, building a lot of trust. Typically what I see in the family therapy is the parent-child relationship. And so a lot of times the parent brings the child in for therapy and they feel like, okay, it's all about the kid. I'm not needed here. They need to talk to someone. They need guidance. They need help. But understanding that you as the parent, you are the most central person in their life that is shaping their life. And so understanding how you can help your kid will also help them, or how you can help your family unit. A lot of times you might have an absentee parent, you might have parental figures that are their grandmother, other members of their family, foster parents and adoptive parents. What I impress upon is that if you are a parent and you have your child in individual therapy, you should be attending some of those sessions, not all of the sessions, not all the time, but you should be attending those sessions as well. If you have your own therapist, that's even better. But you should also be attending sessions with your child as well, because it's not about just the kid. Also, there's two perspectives in the parenting unit. So sometimes the other parent is absentee by their own choice. Sometimes there's certain reasons why they cannot, be in that child's life. As a therapist, I always, try to figure out that piece, like, where is that absentee parent? Are they going to be involved in this therapy? And a lot of times, like, no, they're not, or they want to, but I want, the child to have their space and things like that. And I get it. But I do also like to have the two perspectives of both parents. Maybe they're trying to reunify their relationship with their child because of certain reasons. So I'm always thinking along those peripherals. I always say, I file things away. As a therapist, I do think family therapy is important, just as important as individual therapy. We can have a lot of people out here with really great coping skills, really great boundary setting skills, and then they might be kind of still failing when it comes to some of their communication within relationships that may have been problematic. While it is absolutely okay to set a boundary with a problematic parent, with a problematic spouse or sibling or whoever that may be, if they are not willing to, kind of come into a sacred space such as therapy and try to figure out this thing with you. And I'm not saying that you absolutely have to do that, but it will help you in the long run. And even for parents, again, I'm gonna go back to the absentee parents because I do want to encourage those parents who they may not have the best relationship with their child for whatever reason that may be. It can be so many different reasons. It's scary when they see that their child now is in therapy. They might feel guilt, like it's all my fault. But I want to encourage, parents to just get active in therapy with your child in particular. I was thinking about that this morning, and I was thinking about my book, One Little Thing, because in this particular book, I do talk a lot about my relationship with my father and how that really kind of shaped my identity of who I thought I was, shaped me as a young woman. And I had some deficits there that I had to overcome. I just want to encourage you to, as you're taking care of yourself in individual therapy, think about, is there an area, is there space for me to also invite family therapy into your personal space with your therapist?